we go. All right. Tonight we're going to be hosting the virtual career chat with our ACEs. We have two of our student hosts, Roida and Selena, that will be our student hosts this evening. And then we also have Shawna Schumacher, and she is a medical lab scientist from Mosaic Life Care in Maryville. And she has offered to join us this evening. And we will go ahead and get started and let Roida or Selena, whichever. I think Selena, you're going to go ahead and start with the questions. We'll let you go ahead and start. If you have any questions throughout the chat, though, we do have the chat box below, so feel free to type in the chat if you want to add to the questions that we're asking for Shawna. You can send them that way. If not, then you can unmute yourself and you can ask that way as well. So I'll let Selena go ahead and get started.
All right. Okay, Shawna, can you please introduce yourself and what you do to our audience, please?
Yes, so my name's Shawna. I'm a medical laboratory scientist here in Maryville. So I do a bunch of testing, analyzing. I do blood collections and all kinds of different tests that you have done at the doctor's office. I'm also as well the blood bank lead. So I do all the blood banking here and all the training.
Wow. Yeah, that seems like a lot of stuff. You have an important role in the hospital.
Yeah, our tests are very vital for doctors to be able to diagnose their patients.
Okay, what was your inspiration for pursuing this career, and when did you realize this career was the right one for you?
When I started getting into all my science classes when I was in college. So you take labs when you're in college with all your science classes. And I found that I was really enjoying working in the lab. And so I wanted to see if there was a career that had anything to do with that. And also allowed me to work within healthcare like I had always wanted to. And I found that this was just the perfect fit for me.
Yeah, that makes a lot of sense. Yeah. Can you share what your daily responsibilities are as a respiratory therapist?
So I work alongside respiratory therapy, and we're all required to do blood gases, which is a very specialized blood draw. And so we take turns drawing them, and it just tells us the blood pH, your CO2 and your oxygen, how much you're breathing in, how much you're taking off. It just helps us to know how to set vent settings for anybody who's on like nasal cannulas or breathing masks so that we know how to help treat them. Other than that, I am responsible for running labs as well as collecting labs. I talk to patients, doctors, nurses all day long, help explain the results, help run tests, help within other departments as well, just to ensure that patients are getting the quality care that they deserve.
Yeah, that seems like a really important role. Do you have like a lot of patient interaction as well while you're doing this?
I do a lot of outpatient draws and hospital draws. And so I get to interact with patients quite often, and they get to know you pretty well, especially in a smaller community like this. They know you if they've been in and out before.
I know like my brother also, he like used to draw blood, and he did that for like a summer thing. And he like told me that sometimes there would be some patients that would like really stress him out because they just did not want to do anything. Have you had like bad patient interactions as well?
Yes, you have patients who do not want to have their blood drawn, which we say if they don't want to have it done, we won't do it, just out of a courtesy thing, because we shouldn't force anyone to do that. But you do have some patients where like it is not an option for them and they have to have it done. And that's just never a good experience for anyone involved, specifically smaller children. When I had to work with them, it's never a very good experience. They do not want to be stuck with a needle, and I can't blame them. But most of the patients we deal with do have a lot better experiences and aren't as difficult to deal with.
For those trickier patients, like what is usually like the go-to strategy to deal with them?
Typically we have multiple people in the room, and we have the parents assist us. If it's a child or if it's an adult, we have a nurse assist, and we have someone to explain what the importance of the testing is so that they understand why we're doing it, that it's not just an unnecessary draw or us just wanting to pick on them. They're like, we need this result to be able to treat them more efficiently. And typically with adults, that helps a lot and they'll allow you to do it. With children, it doesn't necessarily matter. They're just difficult in general, and it just generally takes multiple people to do them.
Yeah, that makes a lot of sense. What do you think is the biggest challenge that you faced during your career?
I would have to say the low staffing. So around the country, like there's just low staffing in this field in general. And because of that, it puts a lot of extra stress on each technologist and a lot of extra work for everyone. So like, for instance, there's like 11.7 nurses for every 1,000 people in the country. And there's one tech for every 1,000 people in the country. There's significantly less of us than there are of nurses, which makes it a lot more stressful because we still take in the same testing volume as if we were more. So it can be a little stressful having less people to help with the load, if that makes sense.
Yeah, definitely. Like, how do you guys deal with that issue? And how do you like work through the responsibilities?
So we do a pretty decent job here of splitting up tasks. So we all work as generalists. So I specifically, like today, I worked in chemistry. Another tech will work in hematology, another tech will work in serology. We try and split it up so each tech is in charge of one department, which can still become overwhelming, but at least we have one person for each department who can work that, and you're not having to do multiple departments at the same time.
Yeah, that makes a lot of sense. Do you think COVID-19 had a big impact on this low staffing and like challenges you've had to face?
Yeah, I think it did. For a lot of hospitals, it caused a lot of extra testing, which was like a huge influx of tests that patients started having done due to COVID. So that could be just generic blood work, COVID tests for like surgeries, any kind of screenings. The lab took all of that. And so like they went from having their normal workload to having an additional workload added to it. So I think like there was a lot of burnout involved with it, just from the extra work that was being added. Yes.
Yeah, that makes a lot of sense. Did you see like a lot of people quit or like lose a lot of motivation to do the job, or were people still willing to do the job?
A lot of the older techs I saw kind of just get over it, and they just kind of decided to leave the field. A lot of them that I've known. A lot of the younger techs that I'm around with, we all still enjoy our job and like don't have that overwhelming burnout. But I did start like almost 2 years ago. So towards the end of COVID, not during the height of it. So I didn't see what it was like before, prior to starting this, where a lot of them saw the influx and were just overwhelmed and just wanted to leave afterwards.
Yeah, that makes a lot of sense. I mean, I feel like COVID would have a huge impact on how people would react and like how hard the job is. So yeah, I could see that happening. What part of your career do you like best?
I like the constant needing to learn. I am very big into education. I really like to constantly be learning new things. And so this is one position where the tests are constantly evolving, the equipment's constantly evolving, diagnosis are constantly evolving. And part of my job is I have to know what results correlate to what disease state or condition. I have to be able to interpret it like a doctor would, so that I know what makes sense and what doesn't make sense. And so we're constantly learning like different tests for different diagnoses. And so it's neat to see the evolution of it and like which tests are now considered better than what were considered a good test a year ago. And so you just get to learn constantly. And so I really enjoy that part of it.
Yeah, that seems like a really important part of the job, and I see how that would be nice. But do you think it also, like having to learn all this new stuff constantly is also difficult in the job?
It can be, yes. Sometimes you get a lot of new things you have to learn all at the same time, and it can kind of become overwhelming. Once you've learned it, it's not as bad, but in the beginning, it can be kind of overwhelming and frustrating for anybody, especially newer techs.
Yeah, that makes a lot of sense. What part do you dislike about your job?
It has to do with the understaffing. I would have to say, as a newer tech, I get overwhelmed a lot if we have like a very large test load. Specifically, if I have to work alone, it can be very overwhelming. Or sometimes just the communication with some nurses. Sometimes what we say doesn't always correlate with what they've been taught, and so they don't understand what we're saying. It can be kind of frustrating on both ends, just because we are taught similar things, but the words we use to describe it is very different. So sometimes the messages aren't always as clear as we think they are. So just
Yeah.
learning how to bridge that gap.
Yeah, I feel like communication is difficult, but I'm sure you get through it and you're able to deal with it in the end. How long on average does it take to get through one test?
It depends on the type of testing you're doing. So when you go to the doctor and you have like a purple top, a red top, and a green top drawn, typically your purple top tests are your quickest, and your red tops are your longest, and your greens are like the medium test. So all tests have different test lengths, and we test for things individually. And so when you get your results back and it's this huge sheet of like results, every single test took a different amount of time.
Wow, yeah, that's really interesting. How is your work and life balance, and what do you do to maintain that balance?
Typically it's pretty good. Right now we're in the process of transitioning to a new electronic medical record, and I am part of the leadership team that's in charge of training everyone. And so I'm in charge of 2 hospital labs right now. And so I take a lot of stuff home to help make manuals and training apparatuses for everyone to learn. But typically when we're not dealing with that, it's not bad. You typically can go home and you don't have to worry about what's going on at work. It's a very easy to like have a separate work life and social life balance with this job. Because you don't have to take things home, and normally you never would.
Yeah, that makes sense. Do you think that you spend a lot of time at work? Like on average, how much time each day do you spend at work?
I work 10s, and so I work 4 days a week, 10-hour shifts. I like that because I get to have a 4-day weekend every other. Some people prefer to work 12s, and some prefer to work 8s. So we have a variety of different shifts at my hospital, just depending upon what everybody likes. I personally like having the first 4 days, 10 hours seems long at first, but once you adjust to it, it's not bad at all.
Yeah, that seems really nice. Do you think like the schedule accommodates to each person's like personal needs?
Yes, and we're very accommodating as a group too. So if I have to work on a day I need to like be able to get off early, everyone's willing to like accommodate that and make that happen. We're all willing to help one another, make sure that we can get to where we need to be, even if it has nothing to do with work.
Yeah, that seems like a really nice thing to have like with your coworkers. Yeah, okay. I'm gonna hand off the rest of the questions to Roida.
Okay.
Okay, so I will be in charge of the next half of the career chat. And something that I just wanted to ask, piggybacking off of the work-life balance, was do you have any flexibility in how you get to choose your hours? So do you choose that, or does the hospital choose that for you?
We have set shifts just to make sure that there's equal coverage. I do work the evening shift, and that's what I signed on for. So I work the later part of the day typically. And so I'm here until 8 o'clock at night, every night that I work. But we have other techs who work earlier in the morning and some that work just like midday. It just depends upon like the needs and what you agreed to. But I have like this week I am working 12s so that I was able to have the holiday off. And so I actually come in like earlier in the morning and stay later into the evening to make sure everything's covered. So really, it just depends upon coverage and making sure that there's equal coverage for every shift.
Okay, so from what it sounds like then, it seems like you have a set number of hours you have to meet each week. Is that the case? And it's 40?
Yes, 40 hours.
Well, it's nice to have that freedom to accommodate to your own schedule, because I know there are many careers out there that unfortunately do not have that. So lab scientist seems like a pretty nice way to go. So the next question is, with being a lab scientist, there must come education. So can you share with us your educational journey and what classes you took in high school and undergrad to prepare for your career?
Yes, so I actually didn't start out as this degree. When I went into college, I went in as pre-med. I got into my lab classes and I was like, man, I really enjoy this. So I actually ended up changing from pre-med to medicinal chemistry and biochemistry because I was a very big chemistry emphasis. Um, and then from there, I was like, I really want to find a career that will align well and let me work in a lab every day. And I actually found this when I was looking. And luckily for me, my college offered this as a degree option. And so I changed to this immediately. It did help in high school, having taken advanced chemistry classes, physics classes, anatomy, physiology. I took comparative anatomy classes as well. So I learned a lot about the body prior to coming to college. And then I would have to say some of my biggest classes that really helped me in college were probably physiology and immunology. Those are very big functions of my job. Understanding how your body works and how your body reacts to different things is a very big part of how all the tests work. And so those would probably have had to have been the most beneficial, as well as I took an analytical chemistry class in college, which is basically just how different machines work. Another big part of being a medical technologist is understanding how to work on different machines. We have a lot of different equipment that we use. And so being able to work on different equipment and understanding each integral part of the equipment and being able to fix it when it needs fixing, you're by yourself, is a huge asset to have.
I think it's really good that you mentioned that because it tells us that, it's important to keep an open mind. And although that lab science wasn't your original intended career choice, you kind of found out what you were passionate about as you moved on and what you were interested in, and then you changed that. So I like how you emphasize that versatility is okay. So the next question I have for you is, do you have to complete any continuing education to maintain licensure? And if so, when and how often?
Yes, so as a medical technologist, you're required to complete 36 hours of continuing education every 3 years. And within that, you have certain areas of study that you have to complete those continuing ed credits in. So I just completed 24 of my credits through a training that I did. But unfortunately, only 6 of them can be applied because I only needed 6 in that field. But getting your continuing ed is not hard at all. You can go to different speakers, you can go to different presentations that they have. You can go, the organization that I'm licensed through, they have their own resources for you to also utilize. So getting your continuing education credits is not hard at all.
So does that usually come in the form of in-person classes or maybe online modules? How does that look like for you?
It's a variety of different things. So yes, I can go to big presentations like in Kansas City, if they have a big blood banking seminar, I could go to that and get credits. I can do different modules on Media Lab, which is a source that a lot of different hospitals use for continuing ed. I can go through and do modules on the accrediting site that I go through. And they have different types of reading modules that you can go through, and it's just to help you stay on top of everything. So really they're open to any kind of education as long as it's education.
That's very interesting. I like how, you have the choice to kind of take credits on what you're interested in. So that is very interesting. Next question is, if you could go back and do one thing differently, what would it be?
I would have to say getting a job as a phlebotomist while I was in college. That was a really hard skill for me to learn when I first started here. And at larger hospitals, you're not required to draw blood. But I wanted to work in a smaller hospital. I really like the small town feel. And with that comes the need to have to know how to draw blood. And so for me, a huge learning curve was just getting my confidence up to do it. And I feel that had I gotten a job as a phlebotomist while I was in college, I probably would have already developed that skill and feel much more comfortable with it.
Is that something you would recommend students that are our age to go through if they're wanting to go into the healthcare field?
Yeah, it'll definitely benefit you, even if you just want to go into nursing. You'll have to be able to draw blood as a nurse as well. And even as a doctor, I've seen doctors draw blood. It'll help you in any kind of field if you want to go into any kind of medicine.
So let's say that, there's a student that does want to do that and they are in high school. What would that look like? How would they apply? What kind of courses would they go through and to kind of reach that point?
There are phlebotomy courses that you have to take, typically through a community college. They offer them, and they're normally not too terribly expensive. They're normally only, I think it's a 6-month program to get your like phlebotomy license. But then once you've done that, most hospitals will hire you on, no problem, especially as a phlebotomist.
Very interesting. Thanks for sharing that with us. Now, the next question I have is, what are some soft skills that you believe are vital to this career? I know you mentioned a few before when dealing with patients that are, kind of scared of getting their blood drawn, don't want it. So, what are some soft skills that you believe are important?
I think having a good idea of time management, being able to manage your time well, because you have to be able to release tests, run tests, and interpret tests all very efficiently. And you need to be able to monitor that. And with that comes also multitasking, being able to handle multiple tests at the same time. That's a skill that you'll develop. And in a lot of jobs anymore, you have to have some level of multitasking. So a lot of us don't realize how much multitasking we do on a normal basis. It's just more amplified in this kind of setting. I would also say communication is one of the most important skills. You communicate with your coworkers, you communicate with doctors and nurses, you communicate with patients. Like, it's just a huge asset to have. Effective communication is never gonna be a bad skill to have. Also, the ability to work as a team. Sometimes you need help doing things, and sometimes you need to be able to rely on your coworkers to help you. And the willingness to constantly want to learn. Like I said earlier, learning is a big part of this job, and it's very important to understanding all the tests. So just being willing to want to learn and want to be more engaged in what's going on within the science around you. Those are about the only ones I can think of.
Now, I know I said no pop-up questions, which we've kind of been defying that this whole time, but that's okay. I wanted to ask you kind of a personal question, and that is, what is one soft skill that you believe you excel at and one soft skill that you believe you could work on? And for the soft skill that you believe that you could work on, what are some ways that you work to improve it?
I would say the one I'm the best at is multitasking. I'm pretty good at setting up a system for me to follow when I'm working by myself, or even just working with others, like just figuring out where I am within my own department. I'm pretty good at figuring out all the different testing and how to set that all up for myself. Communication is something that people can always work on. Sometimes I have issues communicating with nurses because of the language barrier. Sometimes we use different languages to describe different things than what they would use. And so I'm working on understanding their language a lot better so that I can use that to explain what I'm saying, so that there's not as many miscommunications between myself and the nursing staff.
Yeah, that does seem like quite a challenge. I know, especially in healthcare, there's lots of racial disparities, and part of that is due to the language barriers. And so when you say that, you try to understand them better, what kind of method do you use? Do you use like translators? I know like there's also a shortage of translators within hospitals lately. So how do you approach understanding them if you can't?
I ask them to better explain what they're trying to get across to me so that I understand where they're coming from. Because sometimes it's simply we're talking about two completely different things and we think we're talking about the same thing. So I ask them for further explanation on their part, and then I provide my explanation on my part. And from there, I try and figure out where the issue lies within.
Yeah, I think that's a really great method. Definitely explaining yourself can help the other person understand where you're coming from a lot better. So thank you for sharing that. Next question is similar to the previous one, but what are some hard skills you believe that are vital to this career?
I think the ability to troubleshoot our machines. So like all kind of machines and equipment and technology, it has errors and it breaks down. But understanding how to fix those errors and being able to understand how the machine works to fix it is a huge thing to learn. And no matter where you go, they all have different machines. You'll never go someplace that has the exact same machines that you were trained on prior. And so it is a learning curve, but once you've figured it out, you'll be fine and you'll excel at it. I would say medical terminology is a big thing. I took a medical terminology class in college, and I thought I knew all there was to know about medical terminology. And then I started here and learned I did not know all there was to know. So you're constantly learning new terminology that they use to describe things, and just making sure that you understand that your results correlate to what they're describing. And then just better understanding the anatomy and disease states and how they correlate within one another, because we're constantly evolving new tests. So you constantly have to know what the new test correlates to and how it correlates. Yeah, and like I said earlier, the ability to draw blood, that's just something that, depending on where you go and what you do, is just something you'll have to learn how to do. But once you've gotten the chance to, and you've developed the ability to, you're normally pretty well set.
That's very interesting. I like how you shared all of the stuff that we need, because, you know, soft skills, hard skills, they're both very important to every career, I would say. Now, with hard skills, I want to ask you the same thing. Is there one particular skill that you excel at, and then one skill that you find yourself needing to work on quite often?
I do pretty decent at blood draws, but I can always improve my skills in regards to that. No one is perfect. No one's going to hit their draws 100% of the time. I have worked on that a lot recently. I work on training our new phlebotomists a lot. And so I see how they do things, and I realize, oh, I could be doing it this way instead of the way I've done it. And I try and implement that and see if it helps me have a better average in how well I do. I do think I do pretty well with troubleshooting our machines. I work with them a lot one-on-one, and so I've learned how to really get them mad and how to fix them in a lot of regards.
But yeah, that's very interesting. I like how you mentioned that there's always room for improvement. I really like that mindset, because like you said, nobody is perfect. And so improvement is something we should all strive for. And then same with the machines. I'm sure experience kind of helps you out with that. You
Yes.
probably struggled the first few times, I would assume. Yeah, but you know, experience helps you through it, and I'm sure you'll do great now. Next question is, what opportunities exist for advancement in this profession? So could you get promoted? Could you specialize? Any of those?
There's a lot of different ways to advance within this career. I'm actually currently looking at advancing my career. You can specialize within each department. I specifically, because I work in blood bank and I am the blood bank lead, I'm looking to specialize in blood banking. You can also advance by getting a master's, and you can become a lab lead, which means you're like the go-to tech to deal with all issues that arise, basically. Our lab lead that we have here is amazing, and she does a great job fielding all the questions, and also educating would become a big part of your job if you did that. You can also go on with a master's as well and become a lab director, which would be your ultimate goal if you were looking to advance your career a lot. The highest you can go is a medical director, unless you wanted to get a PhD, and then you could advance to a pathologist.
Yeah. Oh, sorry.
It's just a lot of different schooling and a lot of different types of advancement that are open to you within this field.
Yeah, I know before you mentioned that you were on the leadership team for the transition to the new program that you are starting to use. Is that something that you believe will help you towards your advancement?
I do. It has helped me learn a lot of different things about training and working with a lot of different individuals. So the leadership team consists of about 130 people within our system. And with that, I work specifically with about 5. And so we worked on developing all the testing methods, all the different types of resulting methods for my blood banking section specifically. And so I do think it'll help me a lot, and it has encouraged me a lot to pursue even more advancement. because I have become more and more interested within this field through doing this and seeing different ways that different hospitals have set things up.
Yeah, I definitely feel like you being interested in this is something that will help you towards advancement. And I think that applies to every career, because if you really are passionate about it, you're going to want to go further compared to as if you weren't. So I like, once again, trailing back to it's okay to change your future plans if you find later on that you actually like something else, because there's always room for advancement, you know?
Mhm.
And now the last question I have, well, second to last, is what advice do you have for students seeking a career in this field, or for anybody that is interested in becoming a lab scientist?
I really highly suggest finding a lab that'll let you shadow so you can see what it's all about, because hearing me talk about it is one thing, but seeing it is a completely different. Getting to see all the different tests that we do and the ways that we do them, I think is like something that will really be eye-opening to anyone who really wants to go into this field. I think that that'll also help consolidate whether or not you want to go into this or you do not. A lot of hospitals are actually open to letting you shadow. You just have to reach out to them and ask them to let you.
Yeah, shadowing is definitely a great way to see whether you like something or not. I know Mosaic hosts shadows for students here that would be interested in that. I believe there's a form you fill out and then Ms. Stanberry can set you up. But yeah, thank you for sharing everything that you said today. It was super helpful to myself and my peers. And thank you for your time. Now, as we wrap up, I wanted to ask, do you have any last thoughts that you would like to share with us?
I would say that this career has definitely been a very successful choice on my part. I truly enjoy what I do, even though there are hardships involved with it. I think that finding a field that you love and that you're passionate about is a big deal, and it really helps you enjoy your work life significantly more. So just make sure you find something that you're truly passionate about.
Thank you. I will hand it over to Ms. Stanberry now.
Thank you so much. I appreciate you both, both Selena and Rolida. Thank you so much. You both did wonderful. Shawna, thank you so much for giving up your time tonight to educate us. We appreciate it very much. And like you said, with shadowing, we do offer that here at Mosaic, and I can help you if anyone's interested. I know that Rolida shadowing again soon. This week, actually. So if anyone's interested, you can go to our webpage, northwestmoahec.com, and there's forms on there and the process and steps that you need to do. So feel free to do that. And you can now even shadow in Maryville as well, where Shawna is. So we can set that up. So if you have any questions going forward or would like to rewatch this or any of our previous career chats, they're on our website as well. So all right, if there are no further questions or anyone has anything to say, we'll go ahead and end it. Shawna, thank you so very much. We truly appreciate it. And we'll talk to you later. Bye, guys.
Thank you.
Thank you.